Now, in the broad plethora, there is private and there is public system. Now, unfortunately, what happens in the government segment is very restricted. There are a couple of hospitals and things, but when we as expats, the international community, forget about the Indian community. I mean, as an internet expats, now if you look at the specialists, the degrees that I mean, again, with a quote that you have all the information in Dubai Health Authority website, but I'm elaborating it, of course. How do they look at? So they are looking, have a look whether you're a fish from the market or you're a fish outside the market. So again, to give a real answer, all these degrees, this specialization definitely is an armamentarium to you. But to enter Dubai, and
Hello, guys. Welcome to another podcast series from Brew with Bones. This time we have with us Dr. Karthik Raj Kuberagani from Medcare Royal Specialty Hospital, Dubai, who's a specialist knee and shoulder surgeon there. He's going to walk us through how to get into Dubai and what are the career prospects in Dubai after residency in India and other countries. So, without wasting much time, let's see what he has to say. Hello, sir.
hi, good evening, good
Hi,
evening.
sir.
So I think I would put this words very clear. Thanks for the invite, and Dr. Giri and Dr. Sa has been like family with us, and they have taken all their valuable time, and both of them are busy surgeons out there. So they've taken all their brewing effort, like brewing with worms, to put these kind of common. I mean, we see in today's world a lot of talks that's been organized, concentrating on what techniques to be done and how the surgical expertise has to be carried on. And sometimes what we forget is that how to start our life, how to answer these basic questions. And this is some question that ponders around everyone. And they have taken the real pain and pleasure to put this kind of, I would say, a practical or a day-to-day question that comes into practice, I believe. So thank you very much for having me in this thing as well. About Dubai, I think the whole talk is about Dubai, the fancy world of Dubai, isn't it? So I would put that way. So I was telling them offline before this recording process as well that now you're asking a person who was not fully settled in Dubai. My one foot is always in India and one foot is always here because I have my setup there in Coimbatore and planning one in Chennai. And now I'm, of course, working with the Medcare group of hospitals here. And again, my father also owns a medical center here. So maybe I would be the right person not to guide you wrongly. Now, just a few words before I even start. A thing is, I think people we have seen we have seen across in conferences. I wouldn't waste too much time on to my intro. I'm an orthopedic surgeon. I subspecialize basically onto the arthroscopy subdivision, concentrating on the shoulder and the knee arthroscopy, predominantly shoulder. Shoulder is my field of work into that. Now, going on to the core topic per se, about Dubai, the opportunities in Dubai, the system in Dubai. Now, I think the first word that I would say is that we need to keep in mind this is not west, this is not east. So, similar way, we are in between both. So, you would experience all concepts that are in between both. You do not expect the Western world here, or you do not expect the freedom of India here, but a combination of both what the system goes by in the system here. Now, in the broad plethora, there is private and there is public system. Now, unfortunately, what happens in the government segment is very restricted. There are a couple of hospitals and things, but when we as expats, the international community, forget about the Indian community. I mean, as an internet expats, getting into the government is a little bit of a issue because of the number of placements and number of criteria. So more easily accessible with the private system here. Right? I mean the private hospitals here, hospitals or clinics and different scenarios out here.
Okay, so sir, what are the typical pathways for an Indian orthopedic surgeon to migrate and start working in Dubai?
So that's excellent. So anywhere across the globe, you might be a surgeon and stuff. So you need to have a valid license here, which comes as a DHA, Dubai Health Authority license. There is something called the MOH, Ministry of Health license. Now we all know that UAE and Dubai are not the same. Now, Dubai has a different license, and Abu Dhabi has a different license, and Sharjah has a different license. Although these licenses are interconvertible. In all practical purpose, we need to give an examination. In today's world, it is a prometric examination that happens. I mean, there are two parts to getting a license. One is they have an examination, which is a prometric. Prior, it was a Viva kind of a scenario. Right now, it is a MCQ based of a questionnaire. Now, predominantly, it's kind of a part copy and paste from FRCS MCQ kind of a pattern, not fully that based, but part based of that. That is the exam part that happens, and the data flow process that has to happen, which involves legal verification of all your documents and your certificates. Now, once you're done and you have a valid DHA, like I'm talking about the Dubai Health Authority license, then that gives you a working umbrella to practice here. In today's world, for anyone who starts or who wishes to come to this part of the world, I would always advise to start with your licensing process, get a valid DHA, and then apply for your job. Because you know the scenario how it was at least 5 7 years back. You get hold of an employer, you get hold of an offer, and then go for your licensing career. Now that becomes a little tricky and competitive. Now people here prefer with a valid license so that for then they can hire you the next day.
That's an elaborate answer. Are there any specific degrees that are preferred in Dubai, or the basic residency in India would do? And the second part of the question is, should we have a particular amount of experience before applying for the jobs?
That's a wonderful question that we have. So what we need to understand is, I think we are restricting our talk more towards orthopedic surgeons, to be precise. Of course, the general practitioner. So we are not talking about GPs and stuff. So as an orthopedic surgeon, we have two categories here. One is a specialist, second is a consultant. Now, if you look at the specialists, the degrees that I mean, again, with a quote that you have all the information in Dubai Health Authority website, but I'm elaborating it, of course. So your basic requirement is to have your residency training in India. Unfortunately, a diploma training, still a postgraduate training that is considered in our part of the world, is not recognized for a practicing orthopedic surgeon here. So a person who is having a diploma degree in orthopedics unfortunately cannot practice it. I mean, until he has a different country degree, but who has taken a diploma orthopedics there is not eligible for a orthopedic license here. Now, who has done his DNB or MS orthopedics is eligible. Now, like Dr. Diri rightly put it across, you need a minimum experience of 3 years. That is when you become eligible to apply for a specialist. Our country India comes as tier 3 degrees according to these guys. So, which means you need a minimum of 3 years of experience before you become eligible to practice here. Now, none of our Indian degrees except D and MCH. Now, unfortunately, in orthopedics, there is no MCH or DM in our part of the world. Till date, MS states that. Recently, of course, I'm aware that there are some institutions that have like AIMS, and I think, if I'm right, a lot of centers are starting MCH program in orthopedics in our part of the world. But at least to our knowledge, it is not a common flow right now, right? So Indian-based degrees to enter into a consultant program directly, it is not possible. So which means there is a back-end entry wherein you need to have 10 years of experience, publications, chapters and all. But amazingly, what seen is that those experience should be in so this is what even I'm facing. I'll tell you the truth. So this is something that is a catch that I see. So which means you have to have spent half a life here in Dubai to really maybe. I mean, this phenomenon might change. I do not know, but as of now, this is what is there.
So, as we have applied and got a licensure, say, and if
Yeah.
you're applying for the job in the centers, is there any preference for additional degrees from the candidates who were applied for, like any FRCS or any other degrees if the candidate is having? Will it increase his chance of successful application?
So obviously, I'll tell you two answers. One is straightforward technical answer. Obviously, the more CV carries weightage, anyone going through a CV will be impressed on that. No doubt about it. No doubt about it. And I'll also tell you a practical answer. See, we are looking at a private arena here, right? Which means as long as you're licensed, your subspecialization, your things all there. I don't think I should be shy telling it on air. Is a corporate mentality. We they obviously look at your patient base, what kind of patient base you have, and to be very frank enough to say, which is not to be a word used in our medical industry, but your revenue generation capacity, right? I don't think I should be shy of. Let's open breaks. That's across the globe, not only here or anywhere, right? So these all things are what they're looking at. So how do they look at? So they are looking. Go have a look whether you're a fish from the market or you're a fish outside the market, right? These are the technical words that the MBA guys use at, which we are not good at as surgeons, and I
Okay.
really don't that as well. So when you're at a person who's going to start his journey into your thing, how big a name is, how big a thing is, he's still a new fish in this market, right? That is how they look at least for the time being, right? Of course, your question on your degree, subspecialty, your age, your maybe your market value that you have done on international shows would maybe help you getting placed there. But to survive the ship, then what you look at is, after 6 months, all these calculations come in.
I'm again going back into the same question, sir. Do fellowships matter? Like if there is a preference to a fellow who's trained in a subspecialty when compared to a guy who has just completed residency? First question is, will the fellowship experience be counted as experience? The second question is will the fellowship give you an edge?
Thank you for the wonderful question. I think this is something that everyone has it in mind. Obviously, your fellowship counts. Obviously, that will be counted in an experience. No doubt about it. I mean, see, that's why I put it in nutshell that it all adds to your value of your CV, and your CV looks bulky and thick, and it's there. See, there are once you enter this industry, you understand how it's a total private sector we are talking about, right? In the government sector, the opportunities are few. It's hard to get straight away into the government sector, especially in Dubai, because there are only a couple of hospitals there, and obviously you need to have the right vacancy and stuff. And yes, so what we are talking 85% is in the private sector. Now, when it comes to the private sector, broadly, there are three arenas. One, hospitals, clinics, and then so-called the premium hospital segments. So that's how they classify, because this is an insurance-based world, right? It's not like our part of the world they're gonna pay. It's an insurance-based market. So based on the level of insurance, these varies, right? Now you need to understand all these specializations would still come under the bracket as specialist. So if you look on an umbrella of bracket, you're still a specialist orthopedic surgeon, right? There are only two clauses, right? You can do all these things. These would help you to increase your patient base, to look at the patients. I'm sure we being in India, it's the same with us as well. This all helps us in taking a niche over the others to establish. Now, what I have seen, because why I answer your question a little blunt, is that not all the setups in Dubai have a specialty based wing, which means it is not a full marginal bracket where, the hospitals have, for example, orthopedics. We have more than 8, 9 subdivisions, right? Guys looking at spine, even you look at spine, there's pediatric spine surgeon, there's colitic surgeons, there's degenerative spine surgeon. Let's come into our jurisdiction of arthroscopy and sports medicine. There is the shoulder guys, there is the knee guys, and there is the small joint guys, and there is a hip guy. So I mean, this is the truth. There is the replacement guy, and there is the pediatric orthopedic surgeon. So if you look at this kind of an umbrella here, I would say it is just happening in less than 5% of your job opportunities, right? Right. And what happens if they are really looking at that kind of a 5%? So that happens mostly in the extreme premium kind of hospitals that I'm kind of, right now sitting like in a Medcare. Medcare is the same Aster DM Healthcare group, but the premium segment of Aster. Right? There is the King's Hospital, there is the American Hospital. You can count a few, count a few hospitals. Now, the problem to get into those hospitals straight away uh, becomes an issue because you're a fish out of the market. One,
Yeah.
from India. And you do not have a consultant license.
Okay.
Now, you might be extremely skilled. The truth is, we are all like, I mean, a proud perspective, extremely skilled, but these two goes, as a conflicting factor. So again, to give a real answer, all these degrees, specialization definitely is an armamentarium to you. But to enter Dubai, you're a specialist orthopedic surgeon, right? So
Okay.
it all depends on the person goal. For example, why is he even coming to Dubai? I think everything narrows down to that question. And yes, it adds a weightage to your CV. Obviously, if there are 10 CVs in the table, that the CV that has a more weightage will be looked it upon. But that is not the main. It's not that I'm trying to err to this side. It is that I'm trying to help also the people. Not they're really keen on coming to Dubai, and that is their only interest to come to Dubai. And they don't want to waste time simply going around all these things. That is the fact I'm trying to put across.
Got it. So that's again an elaborate answer. So if there is a another question here. So now as the orthopedic residency seats are increasing, so people are diverging into multiple degrees after orthopedics. Like you told, few central institutes have come up with MCH, and
Correct.
I know a handful of people pursuing PhD. So does the MCH or PhD change the licensing there? Do you become a consultant if you have an MCH or a PhD in orthopedics?
PhD. So PhD as of the current armamentarium, no. Right. So I'm answering this question when you're entering straight away, right? I'm not answering question if you're practicing already 5 years in Dubai. There are a lot of side bridges when you come here. Then you can submit and show them your works. But I'm talking on a straight away as a no. Now this MPH I do not know, because if you read the Dubai Health Authority, they divide every country international degrees into tier 3, tier 2, and tier 1. Right. So if you look at the Indians subdivision, you can maybe in your talk you can even put a link of that so that people can refer that as well. Our degrees, MS, MD, DNB, all comes as tier 3, right? And tier 2, what they put is MCH and DM, right? Now, I do not know how to answer this MCH orthopedics myself, because this MCH is a new baby in the kit, as you told. Now, because these guys, what they have in mind is the MCH of the like Castro, MCH, Castro, and MCH, these things. But maybe yes, because MCH orthopedics, which is coming up in the new, maybe helping them to go straight away with a consultant degree. Again, even that will come as tier 2, which means you need to have a couple of years experience or something like that. After that as well, I believe.
So this shows us that there is a two clear bridge, like one is a specialist and the other is a consultant. So if we need to be a
Correct.
consultant, then you need to have 10 years of experience in Dubai. And if you want to enter as a specialist, which is a common in the existing pathway to Dubai, you need at least a couple of years of experience and a
No,
valid degree.
3 years, 3 years, 3 years
Okay, years
experience.
of experience and MS degree. So, if all of us are entering it as a specialist, do we have sufficient surgical work to do, or will be practicing only in OPDs, or how will the work look like when you enter as a
So
specialist rather than a consultant?
this is what I wanted to answer. On the work perspective, both are treated as the same. See, as a specialist, again, you're independently privileged to do surgeries. I mean, you independently can treat your patients, at least in the private sector, right? I'm talking all about the private sector. You are an independent surgeon. You can treat your patients. You can do whatever is it there. It is the same, right? So what differs on the private sector between the specialist and the consultant may be on the salary basis. Otherwise, the independence level is the same. Of course, there are certain other privileges. You can have multiple other attachments. For us, it is 4 and 5, but those really doesn't make a difference when you are employed. Those make a difference when you go as something called a CBD basis that happens here, which means you're not employed to one hospital. You're on your the same way you do freelancing in India. Yeah.
So the common dilemma what people might have is like it is like a Indian setup where multiple specialists must work under a consultant. Is it the flow of work how it happens? No, it's all independent specialist work.
Correct,
Okay.
correct.
That's clear from your answer. Thank you.
To put it blunt, the only difference between the specialist and the consultant is the salary, and the consultant has medico-legal liberty, I guess, to perform a lot of procedures
That
or various.
no, that's a big word, medical legal. I don't know. See, I'll tell you how it is. So theoretically, a consult. If you go to the government sector, your answer is right. Specialists work under consultant, right? In the government sector,
Okay.
right? Now, when it comes to a private sector, because as per the licensing, a specialist is also an independent surgeon who, according to his privileges, can do the procedures that he is privileged to do.
Okay.
So the private setups, at least 85% of the private setups, treat you as an individual, independent person who can treat his own patients, right?
Okay.
Now, being a consultant will, I wouldn't put it as a medical legal liberty. I would put it as like, for example, you are going in terms of the academic ladder. You want to start fellowship programs under yourself.
Okay.
You want to start having multiple hospital attachments under yourself. You want to do I mean more into that, more into
Okay.
that. You have more things that becomes easier once you become a consultant.
Okay.
So you have the liberty to spread your wings once you are a consultant.
Yeah, obviously. That's a better word, I would say. Yeah.
Okay.